All right, it's 1:31. We're going to get started. Good afternoon, everyone. My name is Tina Barona, Media Relations Director for Hartford HealthCare. Thank you all for joining us for this live media briefing. We have with us today, joining us is Dr. Ajay Kumar, our Chief Clinical Officer, and alongside me is Dr. Paul Anthony. He's the Medical Director of Employee Health for Hartford HealthCare, as well as the Assistant Director of Infectious Diseases for Hartford Hospital. So thank you all for joining us. I know you have a lot of questions. That's why we've assembled our experts to hold this media briefing. So we'll do brief introductions first, and then if you can ask your questions in the chat room so that we can ask them of our experts in the order that we receive them. But for now, Dr. Kumar, do you want to kick things off?
Thank you, Tina. Good afternoon, everybody. Thank you so much for your time and your attention to COVID and vaccine. I'll start off with just the data about the COVID, where we are, what are we seeing in Hartford HealthCare. So the good news, let me start with that the state overall has seen a decline in total number of hospitalization in terms of COVID, which is a good sign. We are really proud of it. The Connecticut is, in terms of vaccination, we have led the country in many ways in achieving higher vaccination rate. And I think we are seeing some positive signs out of that consistently. Hartford HealthCare today has 101 patients. We still continue to see a fair amount of patients who are admitted to the hospital who are unvaccinated. We do have vaccinated individuals as well in the hospital who have had breakthrough infections. However, those are some of them are unrelated to the COVID. They are coming in here because of other reasons, and we happen to find COVID because we test everybody. As safety is one of our highest priority. And I'll give the number regarding the COVID in the hospitals, and we'll talk about vaccines in a few minutes. Bacchus Hospital has 18 patients today. Charlotte Hungerford has 9 patients. Hartford Hospital has 36 patients. Midstate Medical Center has 9 patients. St. Vincent has 8 patients. And Hospital Center Connecticut has 20 patients at this time, and Wyndham has 1 patient. Regarding the vaccination, we are still in the process of going through our mandating vaccine across the Hartford HealthCare. And I'm really proud of our teams. Everybody from our managers, supervisors, our colleagues, resource groups, our teams across the system who have really engaged our colleagues and met them where they are and having conversation about not just about the vaccine, but what is the concern about the whole COVID and vaccine in itself, and try to provide information and colleague support. We actually open a call center for that, so anybody can call and ask questions about the vaccines. And I think this approach of ours in Hartford HealthCare of compassionate and humanistic approach of talking about the vaccine, I like to believe is working out very well. We are seeing almost 98% of our colleagues vaccinated across the Hartford HealthCare. What's important to note, we have more than 4,000 physicians and advanced practitioners in Hartford HealthCare. And our rate of compliance is 99.5% right now of those individuals who have provided the information that, sorry about that, provided the information about their vaccine proof. Excuse me. That is not a good sign of the media briefing, but I hope you can take it. So we find ourselves in a good place from medical staff and physicians and advanced practitioners leading the charge with a very high rate of compliance. Those individuals who had not received the vaccines either are locums or do occasional work with us, and we are still reconciling the data, and hopefully we'll have a better understanding on that part here. Now, in terms of vaccination for our colleagues, the 98% is a good number, but we are not satisfied. I think we are seeing increased number of reports about the vaccination proof is coming through our inboxes today, and we will continue to see late tonight. And tomorrow, we will have a much better number on data on exactly how many individuals have chosen not to be part of our organization. And I think those individuals will be obviously given appropriate suspension and timeline to think about they want to change their mind, engage people like Dr. Anthony and other members to make a decision at this time here. So with that, I'm going to pause here for some questions which are coming in. And I'm joined by Dr. Anthony, who actually has been a critical part of our COVID management and vaccine mandate across the system, and will provide additional background as well as the questions arise.
We do have our first question from WFSB Channel 3. Ajay, you briefly
Yep.
touched upon this. Is there any penalty for employees that don't get vaccinated or miss testing? Do you expect any employees to be terminated?
There are two questions here. Let me try to answer both of those. The penalty for those individuals who decide not to get vaccinated is that they may not be part of our organization over the time here. So there could be a termination at that time, those people who are not going to get vaccinated, unless they're exempted unless they're exempted, actually. Individuals who do not get testing, we believe in just culture. We want to make sure that what are the barriers why people are not getting testing done. We want to address those things. And obviously, if the individuals have decided not to get tested, despite not being vaccinated, yes, there would be some consequences at that time about whatever the process is going to evolve into that part here. Do we expect employees to get terminated? I would phrase that the employees will make decisions about their employment themselves if they have not decided not to get vaccinated at that time.
As we wait for additional questions, Dr. Anthony, if you could just describe sort of the process of working with colleagues, the colleague support line, all of the education that you've been involved in up until now. If you could just talk briefly about that.
Yeah, thank you, Tina. So when we started the process, we initially had large group webinars where colleagues could come in and we would, no agenda, we'll talk about the vaccines and they're free to ask their questions. And that led to many one-on-ones or small group discussions where we would exchange information. And after that, we, like Dr. Kumar mentioned earlier, we had the colleague support line where people could call and ask physicians about their individual situation questions and get answers and guidance. And we were all open to discussion with colleagues. And it was like, I learned a lot during this process, and people have approached you and in different ways by email or personally to ask personal questions. And I hope like we managed to get several people that were on the fence or unsure to get the vaccine.
We do have a question from Lisa Carberg from Channel 8. It is not in our chat. She's asking via text message. She's not on the chat. But her question is, I'd like to know if the total number of employees in your healthcare system and the total number of employees currently unvaccinated today.
Sure, let me unmute myself, that helps. So we are an organization of 34,000 individuals across the state. And let me describe the 34,000, what that means. That includes all our colleagues, such as physicians and advanced practitioners who work in Hartford healthcare ecosystem, but they're not employed by Hartford healthcare. It also includes contingent worker and contractors and individuals who work in our facilities in other areas. So what we have done is that we've adopted two processes. One is through our employment model that we have asked everybody to get vaccinated, and through the individuals who are part of our medical staff, our medical executive committees of all our sister regions have voted unanimously to allow, I should rephrase that, all of them have voted to expect a vaccination from all of our medical staff as well. So our medical staff is getting vaccinated and who are not employed by Hartford HealthCare, also the rest of the colleagues as well. We have 27,449 colleagues who are employed through Hartford HealthCare directly, not through contracted, not through medical staff process, including the vaccine expectations. And we received close to 1,000 exemption requests. And as I talked about, we will get some numbers, details tomorrow, but I can already assure you about 2 days ago, when we were looking at the number among those individuals who were on the fence, today it's 150 down. So we are seeing significant increase in those individuals who are already vaccinated. As of this morning, as of last night, actually, around 500 individuals were still on the fence and or have not submitted the documentation of their vaccination, which many of them have submitted this morning, and I don't have the final count, but tomorrow we will have some more information on that.
Ajay, while we wait for additional questions, can you just talk a little bit more about the commitment to the clinical environments? This is about controlling the spread, meeting our colleagues where they are, and providing that access, really the commitment from the organization level.
Thank you, Tina. So, we've always prided ourselves on the concept of safety. That's been our priority throughout the COVID journey, and making sure that we we create whatever the process, whether it's a PPE or screening process, visitation, is in the mind of creating a safety for our colleagues, our patients, our visitors, and all of those individuals who work in our system. And we have provided other resources during the vaccination time, whether it's the easier access to vaccine or our colleagues support groups, such as individuals who are discussing about the challenges for minorities about the vaccination. We also have available clinical leaders, such as Dr. Anthony and Keith Grant and Dr. Ulysses Wu and Dr. Prem Kumar, and then many others individuals actually who are reaching out, actively engaged in conversation with those individuals who want to have more information about vaccine, engaging in one-on-one discussion, including myself. We have always taken this approach about the vaccination from the point of safety and being humanistic about that. Not to judge anybody's decision, but to provide the information, provide the knowledge about the vaccine side. We're very proud that we have some individuals, our supervisors, managers, they've been also advised and they've done it themselves, approaching their colleagues in a non-judgmental way in discussing about the vaccine. And we've seen a significantly positive results. And Tina, I hope I answered your questions, but anything specific, if I need to elaborate, I'm happy to do so.
No, I think that's great. I would also maybe just touch upon, who is coming in, what were some of their concerns? Maybe Dr. Anthony, you could address this and how you sort of coached them through the process. If you could elaborate a little bit more on that.
Sure, thank you, Tina. So it goes like, there's a wide range of concerns patients and colleagues may have had. So for example, one of my very first conversation was a patient who was worried that I heard this vaccine can cause allergies and I have a lot of food allergies, and the person was not willing to get the vaccine because of that. And we talked and we explained the difference, and the person was willing to take, actually the person booked the vaccine while I was still talking to them and went to get the vaccine the next day. It could have been because of information they read over the internet that they wanted to discuss it with us, and we were happy to sit down and discuss about the track record of vaccine safety and the performance of the vaccine. Some questions were regarding breakthrough cases, and like Dr. Kumar mentioned earlier, it was really, we talk about how yes, people who get the vaccine may still get the disease, but as you go higher in terms of level of care in the hospital to deaths, you see less and less people were vaccinated getting through that.
And I think it goes back to the earlier point that we were talking about. It's really about, Dr. Kumar, the access and being able to provide that access and that education that has made a difference in the numbers that we're seeing. Is that correct, would you say?
That is correct.
Yeah, that's very correct. I see Ken actually has a question regarding, do you have a percentage of how many of 34,000 overall and the 27,449 are vaccinated at this point? Ken, I'll give you a ballpark number because there are two different numbers I quoted, and I would want to wait for tomorrow to come to give you precise details. In excess of 98% of individuals are going to be vaccinated, most likely by tomorrow. I'm hoping it's going to be 99%, but right now, as of this morning, it's about 98% right now.
I know there's more questions out there. I know all of you, I think, have asked me questions via email, so that's why we wanted to make our experts available for this media briefing. So please do ask your questions. We have a few minutes left, and I know you all have questions. So,
Tina, I do want to highlight one other point.
Go ahead.
The vaccine mandate, it's an interesting process where the information and data gets reconciled. Only in every single hour, there's a different number to look at, and that's one of the reasons it's unfair to comment on the numbers, which are not final yet. And we want to present the details in the spirit of transparency, as we've always believed in Hartford HealthCare, where the numbers are known to all of us in appropriate fashion. Otherwise, these things can be misconstrued or misunderstood by many. And I'm certain that the individuals who have chosen not to get vaccinated or have not received an exemption are making decisions about themselves and their future and their career at this time in what that would be. But our resolve in Hartford HealthCare has always been to providing a safer environment for our colleagues and patients. We'll continue to do so.
It is important to mention, as you said, it is a very fluid situation that the numbers are changing, and
yes,
by the time the 6 o'clock news comes, it'll be different. So that is the reason. I don't see any additional questions in the chat. which I'm kind of surprised at.
It's Dr. Anthony's effect.
Yeah. I know there are more questions out there, but we will continue to keep you all updated. It looks like another follow-up question from Ken Goslin from the Hartford Current. Could you go over the exemption numbers again?
Paul, would you like to take this?
Yes, sure. So in terms of numbers of exemption, we'll tell you that we received about 1,000 requests for COVID-19 exemptions. I can tell you that the vast majority of them were religious, and that we had a process that was set up from the get-go where there was only a couple of persons that could see the actual request. It was de-identified, and then the exemption request would go to we had two committees set up. There was a medical committee and a religious committee, and they would look at it, and I would not know if it's coming from Dr. Kumar, from Tina, or anyone else in the organization when the exemptions would be reviewed. And then the exemptions would be granted. It would be fair, and that's where we are right now. So about 1,000, mostly religious. Again, like Dr. Kumar stated earlier, it would be unfair to give you a number right now, and we'll have further details when we reconcile everything.
All right, we have a question from Sierra Hooks. She's from the New Britain Herald. Not sure if you covered this. What is the deadline for employees to be vaccinated before penalty?
I would refrain from the term penalty. I would just comment that the deadline is end of the day today. And we are hoping our colleagues who are still on the sidelines will make the right decisions and make a decision about their employment as we go forward.
All right, as we wait for possibly additional questions, I know this is not a shy group, but maybe we've answered all their questions. But until then, Ajay, do you want to maybe, or actually Dr. Anthony, do you want to maybe come up with some final thoughts for the group?
Paul, you want to go first and I'll go after that?
Sure. So I think, again, like Dr. Kumar said in the introduction, we're really doing the right thing and the safe thing at Hartford HealthCare. It's really about safety. And the data has shown that the COVID vaccine is safe, and it's a good safe measure to help not only prevent the disease, but decreasing mortality. And we take the safety of our colleagues and our patients and our community very seriously. And really, this is what this is about.
Thank you, Paul. And I'll just make one other comment regarding the COVID. And there's one more question Nicole has just shared. I'll come back to that in a second. Although we are seeing 25 to 27% breakthrough infections, a fraction of them are coming with COVID. It's about 10 or 11% in Hartford HealthCare. And we're doing a regular chart reviews to make sure the reason for admission is COVID and not incidental findings, such as somebody comes with fall and happens to have a COVID, and they don't have any symptoms about regarding the COVID. Among the vaccinated ones, obviously in unvaccinated ones, we've seen all sorts of age range and people requiring ventilations and ICU support quite consistently. Also, one thing I'll mention that Connecticut has done a very good job in vaccination percentages overall. When you have a large amount of people who are vaccinated, we expect to see slightly higher percentage of breakthroughs in our hospitals as well. And that might be a different case when in a state where there is a 20-30% vaccination rate, you will see those number of breakthrough infections coming in just by the way the math works out, a lot less percentage of that. So I want the team to understand that our process of vaccination of the higher number of vaccination in Connecticut has prevented mortality, has prevented significant critical care stay and hospitalization, which is where we need to be in terms of fighting this pandemic. So as we progress through this fall season and the winter, I would encourage everybody to go to Hartford HealthCare vaccine site and register yourself if you qualify for booster or for your third dose if you're immunocompromised. And happy for anybody to take a question on that particular process as well. But we have a lot of sites right now who are offering vaccine boosters. And I ask and encourage community members to consider getting a booster and third dose as well.
All right, let's go to Nicole's question from WNPR Radio. Will exempted clinicians or patient-facing employees continue to provide in-person care, or could their job functions change as a result of their unvaccinated status?
We call the expectation we will have from those individuals, they would be weekly tested and they will wear, obviously abide by all the appropriate PPE regulations. We don't intend to change their work. They would be providing the care at the time. And I'm hoping that over the time, those individuals will, who have non-medical reason at least, or some reasons why they're not sure about the vaccine, would engage in the conversation and make decisions over the time.
I don't see any other additional questions. Any final thoughts, Ajay?
No, I think thank you so much, Tina, for putting this together, and I hope it was useful. And we'll be providing the details as soon as we know the details and exact numbers, and we'll be happy to share that part.
Stay tuned for more. Thanks everyone for joining. Dr. Kumar, Dr. Anthony, appreciate your time.
Thank you.
Thank you, Tina.